So you probably saw a video about autism and said, oh, that's uncomfortably accurate. And now you're wondering, do I need an official diagnosis? Or maybe I can just know this about myself and move on. My name is Jonathan Murphy, psychiatric nurse practitioner, and I've been working with adults with ADHD for a decade. About 30% of my practice are adults on the autism spectrum. Today, we're going to walk through what it means to get an official diagnosis and if you even need one at all. And just a reminder, the only person that you need to understand your brain is yourself. In other words, I can lead you there, but it has to click for it to make sense. It doesn't matter what formal diagnosis I put on a patient's chart. They might have never realized it before, but they were still on the autism spectrum before they came into my office. But if you're watching this video, my hope is you can sort this question out for yourself and then decide whether or not you need to go to a provider and know what to look out for. So if what you've learned about autism spectrum disorder has you going, yep, that's me, you're most of the way there. And that's one of the things I love about diagnosing autism spectrum disorder in adults. It is rare to talk about a diagnosis with someone and have them immediately feel better simply by understanding it. One of the most common things I hear for patients on the autism spectrum that I see is that they don't like the label. And that's okay. You can call it whatever you want. But if internally you can go, yep, this is me, this is how I work, which helps you inform your understanding of how you navigate life and relationships, at the end of the day, that's the most important thing for everybody. And the truth is, there are very few practical reasons to really pursue an autism spectrum disorder diagnosis. First up is the workplace accommodations. And the ADA is a thing for a reason. You want to protect yourself with every opportunity the system allows you. And because I've written 2 workplace accommodation letters this week, it is important for me to say you want to seriously consider your stress level in the workplace. If everything's fine, maybe keep it in your back pocket if you're not comfortable talking about it. But if it is super stressful, you're probably gonna want to disclose it with your employer. If you're going to college, you're probably gonna need educational accommodations. And sure, you might be able to get through just fine, but you could also burn out pretty hard too. You might need to access specific services that require documentation. Because this is the intersection between psychiatry, mental health, and the legal government world. Which leads me to explain what is an official autism diagnosis. The same thing any diagnosis is. It's a code that goes on a chart. That label can help us understand you, but if anyone says I can't diagnose that, what they really mean is I'm not comfortable putting those numbers on a chart. And that's fine. I get it. There's very little formal training about autism spectrum disorder. But the problem is a lot of people become comfortable at the tune to $2,000 to $3,000 when your insurance can cover it just fine with a normal psychiatric evaluation. But at the end of the day, you just need a provider that's going to vouch for you. So if you go on Psychology Today, make sure you click that button about autism spectrum disorder. And if they're charging you an obscene amount of money to put some extra numbers on a chart, move it on over. When I first became comfortable in identifying high masking autism in adults, I would say the thing most people do. It's time you got an evaluation. And then what happened? They would get an evaluation. It would cost a ton of money. And then I would say, what did you learn? They're like, well, nothing. They'd spend thousands of dollars. I would be all optimistic and hopeful for them. I would ask them what they learned, and they would say, not much. In other words, nothing. But what I'm interested in are the same issues that face people despite what they look like on the outside. You need to think about if autism spectrum disorder fits for your brain from the inside out. But at the end of the day, it's about self-direction. So when it comes to autism spectrum disorder, only you can define what it means in your life. Many of my patients don't say anything. But that additional knowledge through our sessions, maybe ADHD medication or something for anxiety, helps them navigate their job and relationships so much better. But then I have patients that are totally open about it, and it's awesome. But it's different strokes for different folks. So in other words, when it comes to self-disclosure, it's nobody's business, unless you want it to be. And I need to be real. People on the autism spectrum are at a higher risk for exploitation. So then when I see these absurdly high price tags for something that I can just put on the chart, just like any diagnostic code, I need to speak up about it. So if you're going to get that expensive evaluation, make sure that you're really clear about what the difference is between what you're going to get in a normal psychiatric evaluation and a bunch of fancy tests. But only you can truly describe your unique life experience. Never outsource that to anyone else. Despite all the noise out there, I know the conversations that I have with my patients are phenomenal. If you missed my last video on autism spectrum disorder, I got that for you right here. And go ahead and hit subscribe if you want to keep receiving practical strategies from a nurse practitioner that won't sell you short.